Yeah, stroke epidemiology, there's roughly 800,000 people a year that suffer a stroke, and those patients are often left with permanent neurological disability. A stroke is when there's a reduction in the blood or oxygen to parts of the brain. And so when a patient's having a stroke, they manifest symptoms. So like they have a facial droop, or one side is droopy, their arm loses control on one side, so the arm drifts. Their speech can be very slurred, like they got marbles in their mouth. And that's sort of the basics of what a stroke might look like. Time is brain is the stroke mantra, and what that means is that for every minute someone is suffering a stroke, 1.9 million neurons die. From this project, we know that telemedicine advances healthcare by using technology in ways that we've never been able to do before. The catch term that we like to use is DTN, or door to needle time, and that's a good benchmark for providers, and we use that nationally. Similar to the NASCAR analogy, we want the fastest treatment when that car comes in to get them back on the road, so to speak. So what door to needle time means is from the time that the patient is brought from an outside place and they hit your door, like the emergency department, until they actually get a TPA drug, so the needle, the IV placement. And the best centers are usually giving that drug less than 90 minutes. Mayo Clinic gives that in 45 minutes, or even sometimes less, which is a world-class number. The exciting part about this telemedicine examination is it allows us, the physician, to beam in and get the NIH assessment while the patient is traveling, rather than making it a passive process until the patient arrives. On average, we saved about 7.5 minutes, so about 15 million neurons or so. And in severely affected patients, sometimes it was as high as 12 minutes saved. So in the past, we would get a message sent out to about 50 people, part of the stroke team. But we didn't know until the patient actually arrived which one of the, or part of the team, actually needed to be there for the patient's care. We're excited now because of advancing technology with telemedicine. We can beam into the ambulance, similar to that NASCAR analogy. We can offload part of the patient's care before they ever pull into that pit stop. And that allows the patient to get along, get better treatment and better outcomes. We're excited about this project because we've shown that using technology, which is getting cheaper, smaller, and faster, allows the doc to beam into the ambulance and deliver some aspect of their care. We're also excited about this because it can be diffused. Other hospitals outside of Mayo's walls can adopt these cost-effective strategies to help the stroke patient wherever they are in the United States.